Good afternoon, and welcome to the Regan Lecture. My name is Guadalupe Hayes-Mota, and I serve as the Director of Bioethics at the Markkula Center. I would like to begin by expressing our sincere gratitude to Bill and Ann Regan for their generous and long-standing support for this lecture series. The Regan Lectures are designed to bring the broader community to Santa Clara University to engage with leading voices on critical ethical issues across disciplines. And today's program is no exception. For today, we'll hear the lecture, and for those staying in the room, we'll have a Q&A afterwards. So it is my privilege to introduce our speaker, Dr. Debra Houry. Dr. Houry is a national recognized physician, researcher, and public health leader with nearly 3 decades of experience shaping healthcare delivery and public health strategy across government, health systems, and academia. Her career reflects a constant commitment to addressing urgent and complex challenges, from providing frontline trauma care in busy emergency departments to guiding national responses to major public health crises. A board-certified emergency physician, Dr. Houry brings a clinical perspective to policy and leadership. At the Centers for Disease Control and Prevention, she served across 4 presidential administrations, including as Chief Medical Officer and Deputy Director for Programs in Science. In these roles, she oversaw more than $8 billion in public health programs, built partnerships across all 50 states, and helped lead the national response to a wide range of public health emergencies, including disease outbreaks and firearm-related harms. During a period of significant political transition, she served as the senior-most career leader in sciences at the CDC, helping to ensure community of mission and uphold scientific integrity. In 2025, she made the decision to step down and later testify before Congress, speaking candidly about the challenges of protecting public health in increasingly polarized environments. Dr. Houry has been widely recognized for her leadership, including election to the National Academy of Medicine and honors from the American Medical Association and the American College of Emergency Physicians. She's also an adjunct full professor at Emory University and a senior fellow at Yale University. And she has authored more than 100 academic publications. Please join me in welcome Dr. Houry.
Thank you. All right. Is the microphone working for the back? Okay, good. Thumbs up. Okay. So I'm going to stand here to where I can see people because I'm a little short. So behind the podium, y'all usually can't see me. You want me to keep going this way? Okay. Get my notes here. Well, it's a privilege to be with y'all, and thank y'all so much to the Regans for having this lecture. I think certainly in our society, it's so great to have the community, universities together to talk about critical issues and the role of ethics when you're looking at decision-making, daily life, things like that. So this is not your formal lecture that potentially you're used to. I thought I would just walk through some of the principles I've used, particularly during a slightly turbulent leadership period of time, and how I tried to lead with integrity and kind of what my mindset was, and sharing some examples. And then Guadalupe and I will have fireside chat with questions from all of you as well. And since I am no longer a federal employee, it's really a no holds barred. So I'm pretty as transparent as it comes. So in case you haven't heard me speak before, but so I'm an ER doc. At heart, I am an emergency doctor. And so to me, what that means is I don't know what your background is when you come to see me in the ER. I don't know if you're Republican, Democrat, Independent. I don't care. I'm there to take care of you as a person. And then when I moved to public health, I was there to take care of you as a population, as a community. And that is how I've always led my life and my career. As an ER doc, my family probably doesn't love this about me, but I think I have like adult ADHD. I always have to be doing multiple things at once. Love chaos, and love just always not knowing what's coming. So again, that was good for what I went through in the past year. But in general, I have found that these principles can really apply throughout your career. The other thing I've learned is prioritization is so important in emergency medicine because you've got a really critical patient, somebody who's not so sick. How do you make those decisions? And how do you do it empathetically and as ethically as possible? So those are the traits that really shaped my life. I was in the county ER for about 15 years before going to federal government. I was, teaching and doing research and focusing on public health at the same time, but who I am at core is a county ER doc. People say I can't say I'm simple, but I'm a simple ER doc. Like those are the traits that I've taken with me throughout my career. Just to pivot a little bit to what is CDC. I know people have heard of it, but CDC had about 15,000 staff, has people in about 60 countries. About 80% of the people are all based in Atlanta, and the budget was about $10 billion. Of the money, 80% goes to states and local communities, so it doesn't stay within CDC. And the programming is really focused on prevention, public health, ending chronic disease, data, looking for infectious disease health threats. Really important core programs that are needed for the health of all Americans and around the globe. And I thought that framing was helpful because I thought I knew what CDC was when I took a job at CDC. And I realized it wasn't as focused on research and papers as I thought. It was very on the ground, boots on the ground in the communities doing that prevention work. And I didn't realize how much of the funding went to states and local communities. That's what it does. It's really saving lives 24/7. So I felt like I was translating ER to communities at CDC. I ran the injury center for about 7 years where I oversaw work on overdose and suicide, became the acting principal deputy where I was the number 2 and oversaw the reorganization. And then as chief medical officer, oversaw all of the medical programs and science. And then why I'm here today is because I was asked to be the transition lead for the agency. And every 4 years there's an election in this country. So every 4 years somebody's asked for the agency to help with the transition. I knew this one was going to be interesting because we had 2 presidential candidates. So I knew that regardless of the outcome, I was going to be busy as transition lead. And I say that because there are some political appointees at the agency, and administration and funding priorities will change. So you have to prepare for that. Usually at CDC, there'd be 1 to 3 politicals. The CDC director is political. When I started, there was 1. Prior to this administration, there were 4 political appointees. So I just wanted to give you that framing. When I left CDC, there were over 10. Now there's 20 at CDC. So just to give you kind of that background. So with a transition, you want to prepare for who's coming in, how you can welcome them, understand their priorities, and ensure that they're successful. So that was the mindset that I've always had. And as mentioned in the intro, I've been through 4 presidential administrations, certainly some longer than others. I was only in Obama for about 2 years, and then Biden and Trump won for 4 and 4. With each administration, what I've learned is how you frame things changes a little bit, but in general, the core work doesn't change. It doesn't change. My first administration change, I was really worried. I was going from Obama to Trump. My budget actually grew during the first Trump administration, and I got firearms funded for the first time. Started a national overdose program. So going into this transition, I was cautiously optimistic, but also nervous, because you never know what's around the corner. So one of the key things as an ER doc, I always say, is over-prepare. Over-prepare for any emergency. And I say that because if you've got traumas coming in, I'm going to have, all the surgeons down there. I'm going to have all my equipment out there. And you know what? If it wasn't that bad or the people don't come, that's fine. You put the equipment back, you're good. So in my mind, same thing for this transition. I read I read 3 of RFK Jr.'s books. I read Project 2025. I read the American Enterprise Institute report. I read America First, inside and out. Took notes on them. I called it a book club. And sent notes to all the centers, because I supervised all the national centers. And I was doing this in a data-driven approach. There were questions about vaccine safety, conflicts of interest, abortion. So I said to my staff, where can we do better on vaccine safety? There's questions around abortion versus fertility. Why don't we have more on fertility on our website? Really put those tough questions out. Where can we be more transparent with our data? And learn things like the secretary had said that CDC, and there's seats up front, that the CDC had lots of conflicts of interest and was making tons of money off patents. So I said, let's look at the data. And what I found was extremely few conflicts of interest, so few that I put up the past 20 years of the Vaccine Committee's conflicts of interest on the website, because why not be transparent about it? So we were. Similarly, patents. CDC scientists weren't making gazillions of dollars off patents. What I found was there were very few that even had patents, and most of them for like orphan vaccines that were barely making any money. So that was really helpful. So we had all that information to prepare for the transition. The other thing we did was I wanted them to be successful. So I was like, what priorities does this new administration have? So when they come in, they can hit the ground running and maybe fund some of our work, maybe uplift it. So I looked at autism and genomics and environmental issues, had that as a priority ready to go. Looked at chronic disease. How could you send the U.S. Commission Core out to communities, look at wearables, have fitness challenges? And then there was a big interest in private sector. So how do you have that ready to go around different technologies? We were so ready. So ready. Unfortunately, we never got to do that. I never briefed the secretary. It's the only secretary in over a decade I had never briefed. So all of that work essentially went to waste. In my mind, it didn't go to waste because we were prepared, we showed we were ready, and when we had questions, we knew how to answer them. But that was the first sign for me something was going to be different in how we were leading. I'm used to being able to have discussions focused on science, data, priorities. If you can't have those discussions, you're kind of flying without that direction. And so that was my first clue to be worried. One of the other ER priorities to me is triage, which I alluded to. April 1st last year was a day that really redefined triage for me. We knew DOGE cuts were coming. We didn't know the extent. And we were also told that when the cuts came, we would have 30 days to transition programs and sunset them. We had 8 hours. And so April 1st, April Fool's Day, I just felt like between firing probationary people on Valentine's Day weekend and then April 1st, we lost 2,500 staff in a day. And I remember I was the only career among all the political leaders in the office of the director. And so I was like, what do I do? My agency literally is changing in front of me. So I pulled together all of our senior directors, including those that were being fired that day. Half of my leadership team had been reassigned to the Indian Health Service, which wasn't aware they were getting them. These weren't true positions. And or some of my team members, center directors, received termination notices. So these are the people that I met with. And throughout the day, every 2 hours, I would say, what are we going to save? And what aren't we going to save? Because you couldn't save everything. So we looked at data systems. Which ones do we sunset if there's nobody to be checking the data that's coming in? Lab animals. When you shut down a campus and you don't have a veterinarian, you're in violation of animal safety. We had to make the decision on euthanizing animals. Really tough decisions. We had an outbreak of lead in Milwaukee, not really an outbreak, but an issue. We were supposed to be sending staff. The entire lead poisoning program had just been eliminated. We couldn't send community responders to Milwaukee. And I remember it was tough for me to look at my colleagues, and I even said, Band-Aids won't work. And these were A+ students that would go above and beyond work 24/7, and I said, it's gonna have to break. And that was like a tough ethical decision for all of us. But I knew we couldn't send deployers. I knew we couldn't staff the lab if there weren't people. We couldn't be running the HIV tests that were needed. So it stopped. It stopped. After a couple months, some of those were brought back because the public, the media started to say, how can we not have these life-saving programs? But that was such a really tough decision and even day. I remember I went straight into ER mindset for the first couple of meetings where people were like, is she human? And it wasn't until I think the third meeting I actually broke down and cried in front of my whole team, because all of a sudden I realized like everything at the agency was changing. Like the stuff I had built over years in a day had been dismantled. And that really set the tone for how we were going to lead as an agency. I learned about like not wasting a good emergency, I called it. And that was where I would point out things that weren't working. We could no longer screen coal miners for black lung disease. We had shut that program down. And when I was asked what was our emergency plan, I pointed to the website, which said, we don't have staff. The program is on pause. That was not considered an appropriate response, but I didn't have a better one. So that was my response for most things was, we can't do it. Over time, some of those did come back, but that was where I learned we needed our partners to be raising the alert. And that was where I didn't have a voice, but the community did. One of the things that really got me through that year was what I call my sleep at night principle. In the ER, I'm looking at a wound. Did I get all the glass out of it? I don't want to go home and perseverate and be going, gosh, I was tired. I went home. I didn't clean it out well enough. I had a couple cases that always stick with me in my head. And I always said, if I believe I'm doing the right thing, I'm going to sleep at night. And so that has been a core principle for me throughout my career. So I did the same with really being the only career overseeing all these programs and tough decisions for 8 months. I was given a toolkit on measles where we had clinical guidance during an outbreak of measles, worst number of cases ever. And the secretary had been talking about healers. And healers are great, but so is clinical medicine. And the healers were promoting unlicensed medications for measles. And when the toolkit went to the department and came back to me, it had suggestions to include many of those. And I looked at it, and I thought, what do I do? This doesn't bode well for my career either way. To either say yes or to say no. And so I went to my staff and said, let's really talk about what's the evidence and science behind some of it. Vitamin A, there actually was some evidence not to prevent measles. But if you have measles and you're vitamin A deficient, which is very few, there is some evidence for vitamin A. So we allowed vitamin A to go up on the website, linked to the American Academy of Pediatrics and the World Health Organization. I could live with that. I could sleep with that at night. I could not sleep at night saying that steroids or antibiotics work for measles. So I actually took all of my staff's names off of it, left mine on, and sent it back to the department with notes. That actually stuck. We did not include information that was incorrect for clinicians. We had another issue like that too on thimerosal. That's an additive that is in flu vaccines. Very few, not even most flu vaccines, very few. I think it was about 4% of flu vaccines. There was a concern that that had been linked to autism. Studies have shown, looking at millions of people, it's not linked to autism. But there is a splinter group that has really lifted that up. Same time, the secretary fired all the vaccine committee members and replaced them with people that did not have the same level of expertise. This is when I was starting to think, what are my red lines? Is this a red line? I hadn't fired the people. I didn't put the new ones on, but I was starting to feel like, where's my integrity in all of this? We saw what the agenda was going to look like, and they had added thimerosal and MMRV, which is a measles, mumps, rubella, plus varicella vaccine, to the agenda. My staff did the right thing. Normally, you have work groups that spend months developing an agenda and a scientific presentation. These were just added to the agenda by the political appointees, and so my staff said we should do evidence reviews. That's what we do. We provide the science and the data. So they developed them. We put it through scientific clearance. I alerted the political appointees that these documents existed, and they went up on the website. The meeting happens. We get a call from the secretary's office to pull down the one on thimerosal. MMRV stays up. Thimerosal is taken down. If they had called me, there would have been a different response, but I was not the one that got the call, so it came down. Or the next day, one of my center directors was in DC doing congressional briefings. He was called by the department. He had to cancel all briefings, meet with them immediately to discuss the document. I then got a call from the lawyers as well, as did approximately 20 of our scientific leaders, to see were we subversive? Why did we do this? Why would we go across against the secretary's agenda of putting something up that didn't align with his priorities? As I said with everything, I can't change science. I can't change data. I can only share it. And if it doesn't reflect an agenda or a priority, I can't help you. Fortunately, we did make it through that because I was able to show we'd gone through scientific clearance. And at the same time, somebody from the Children's Health Defense had presented at the meeting as well on thimerosal using, I think, AI because some of the references were invalid, which is pointed out by the media. I did not know I was going to be investigated at the time, but I sent a note to the political appointee because I do like to sleep at night. And I said, this does not reflect well on the agency. When we have a presenter, it should go through scientific clearance. This did not. It's reflecting poorly on the CDC. So when I met with the lawyers, I said, everything should go through scientific clearance, including political appointees' presentations. I said, so I'm holding everybody to the same standard. And I said, too, if you get rid of my staff, I'm going too. Like, nothing was done wrong. And those are the times, I think, to where you have to be comfortable losing your job. That was when I actually cleared out my office. That was in April. When I first cleared out, June was the investigation. But I cleared out my office except for what was on the walls. So that all the political appointees on my floor didn't know that I was prepared to walk out any day. So I showed up each day fighting, protecting the public, and protecting the staff, knowing that my job was not to save my job. It was to be ready to quit or to be fired. It was not the best 4 months of my life, but I did make it through. And the other thing I learned too was with red lines, you've got to know what they are in advance. Because when you're in the moment, you think, have I hit it? This isn't so bad. They need me. I need to stay. So beginning of January, I'd written out my red lines on my phone, looked at it every morning. Around April, when many of our programs, some of the center directors that reported to me were starting to be asked for vaccine data or for some of these measles toolkits or other things, I sat down with each of them and said, what are your red lines? And they said, we don't need to do this. I said, you do, because at some point, you should always know what your red lines are. And to several of them, I even said, you should write a draft resignation letter. I had written one in March. I had actually offered to quit in March around the Doge cut and was able to save several programs as a result. But I knew the second I said, I'm quitting, that there was a chance it was going to happen. So the best thing you can do when you're trying to navigate a circumstance like that is to be willing to walk out the door and to know that it's going to happen, but you want to do it on your terms. So my resignation letter that came out in August, it's about 80% of what it was in March. Every few weeks, I just updated it to reflect current things. But I was ready. I thought it was really important that, I needed to walk out the door. I wasn't thinking, gosh, did I get my daughter's frame? Or what, I don't have all my files. I knew I wasn't going to last, so that was what I did. I was actually ready to leave way before I did. But then we experienced a shooting. Over 500 bullets were fired at CDC by someone that believed they'd been injured by a COVID vaccine. We didn't hear anything from the secretary for a few days. He was fishing, as posted on social media. Unfortunately, the president didn't acknowledge the shooting either. And an officer lost his life in the line of duty saving my team. Over 180 bullets hit the windows. People felt personally impacted by it because this was violence directed at science and about speaking. After that, staff took their names off papers. They didn't want to present on vaccines. They didn't want to report on things like firearms. Anything that could be at all politically charged, staff no longer want to be associated with. We were losing scientific voices. At the same time, I realized my ER doc, Protect People, kicked in again. I had people that were impacted by trauma. They couldn't show up to work. Some couldn't sleep at night. And we were still getting regular routine data requests, on weekends. And I just said, I had a woman cover up her child in the daycare parking lot as bullets were flying overhead. I had somebody crawl from the ride share to security. We aren't answering your questions. And again, I was surprised I still had a job after that. But I just said, we aren't answering your questions. I have a traumatized workforce. And that's where you also have to be willing to be the advocate for your patients or your people. I said, all requests can come through me. I will determine if they're urgent or not. I will determine, who can respond if it is urgent, because I have staff that can't sleep, that can't take care of themselves. They're scared to come to work. I am not going to ask them to work. And that was an incredibly tough time for our staff. No matter what campus you were at, you felt it was directed at you. I did meet the secretary 3 days later. He came to our campus that Monday. And for me, seeing the damage to the buildings was horrific. I walked and saw bullets in the doorframe of my colleagues. I saw shattered glass everywhere. And the secretary, did look distraught by it, and then did an interview that afternoon where he said we weren't sure of the shooter's motive, and that it was okay to question experts. It is okay to question experts sometimes, but maybe not right after there'd been a shooting. There was other things I probably would have suggested saying first. And so that didn't land well with our staff. I knew at that point in time, my leading, everything I was doing to save programs, to save our staff, I was losing more than I was winning. Each day I realized my wins, I could barely even count them. My losses each day were really, honestly, ripping out my soul to where it was hard to show up. But I knew as the one career, I was that last level of scientific integrity standing. Our CDC director had been there for 2 weeks at that point, and got a memo from the department saying she couldn't make any policy or staffing decisions. And I saw it. I saw the email. It's valid. I said to her, I'm done. I can't do this. And she said, let me see. She got called into the secretary's office that Monday. And I called my 2 vaccine people who I talked about the red lines with. And I said, our time has come. And one of them had been at CDC for 32 years. And he even said, I've never written a resignation letter before. I don't know what this means. And the other one had listened to me and had a draft resignation letter from April. And I just said, we have a choice. It's time in my mind as an ER doc to call the code. I've wanted to call it for a while. I've been resuscitating the patient for months. And I'm like, there's nothing more we can do other than lose our integrity, lose the ability to speak about what's going on, lose the ability to actually protect the human all the populations in the US as things that I was concerned about scientifically were being pushed through. So I said, send me your resignation letters. I was their boss. I said, don't put a date on them. I had my draft in my inbox, and I said, we'll sit on it. Let's see what happens. And so for 3 days, we waited to see what would happen with Susan Menares. And then when she was fired, I hit send. And the three of us on that Monday had taken a vote. What we're going to do together, get fired or quit. And we decided we were going to quit and we were going to use our voice. And so I hit send Wednesday night. Thursday morning, showed up, took my 2 bags, got the rest of the things off the wall. My poor colleague Dan, after 32 years, had not cleared out his office. Took him a little longer. They had to send stuff home. But we walked out. And, you know, it was one of those things to where it was so bittersweet because you want to save what you can. But in that moment, I knew the only way I could try to save that agency and health in our country was to call the code, walk out, and tell the American public what was going on. And I got a call later that week, too, saying, I'm going to need you to testify before Congress. And all I said was, I've been waiting for this call for months. I'm ready. Put me in. That was a different experience. Happy to answer that during Q&A. But for me, you know, I would say during a time like that, you need to know who you are. You need to know what your red lines are. You can't compromise when it's impacting other people's lives. And you can only do as much as you can for as long as you can. At some point, you have to think about the toll it has on you physically and mentally. And I can tell you, I look much healthier and happier now than I was, you know, for those few months. But you also have to have that teamwork, that camaraderie, those honest, vulnerable conversations. I had to trust those that reported to me when I was having these difficult conversations around what I was seeing, what we were being asked to do, and what we wouldn't do. And what I can tell you is the three of us, we never compromised on integrity, science, or anything that would impact health. So with that, we'll do Q&A.